Most times when they're talking about fertility issues, men, especially men in Africa, they don't involve themselves or they exclude themselves. Some men will tell their wives that, no, I don't have a problem. You go to the hospital, you are the cause. I don't have any challenge. Men have fertility issues as much as women do. Please do not be ignorant and delay your childbearing. And because sometimes some people chase their wives away, divorce their wives, and then go and marry another woman. And then the woman, there are two things that happen. It's either maybe sometime your diet improve in some ways, or you got some kind of healing by going to the hospital and then taking some herbs. Some people take herbs, or the woman is giving birth with another man and giving you, because your ego will not allow you go to the hospital to sort yourself out. So she decides to make you a father by another means. Please, let's not be fathering other people's children. Let our brothers, our uncles, our husbands be the fathers of these children. So we're going to be talking about the risk factors of male infertility. What are the causes? What are the signs of male infertility? The biggest causes of male infertility, people will say, is the indication number one is inability to conceive, inability to impregnate your wife. Yes, it is true, but why is the pregnancy not happening? That is what we are talking about. So that you will not just, some people just go and do sperm analysis. They don't know any other thing. As far as they give their sperm, they feel it has ended there. That is why we're here today. I'm here to educate all of us, including myself, so that we'll know why it's not happening. So some people suffer difficulty with ejaculation. They cannot ejaculate during sex. There's no way you can impregnate a woman when you don't ejaculate, because it's the ejaculation that brings about the fertilization and implantation, pregnancy, and then carrying to full term and delivering a bouncing baby, healthy baby. Then some people have quick ejaculation. Some people are not ejaculating at all. The next point is quick ejaculation. Any sperm that is being ejaculated very quick, most of the time is very unhealthy. It's watery, the viscosity is very poor, everything about the sperm is whack, not good. That's why it cannot stay. It's coming out very, very fast. Within 1 minute the man has ejaculated. Some people, they struggle to even have an erection. Before you know it, they don't even ejaculate, just go down on its own. Bam, nothing is happening. Then we have low sex drive. For you to be experiencing low sex drive as a man is something that is causing it. Your hormones are either unbalanced, you're suffering from anxiety, you're suffering from chronic stress, which are causes of infertility. Then we have pain, swelling or a lump in the testicular area, which is caused by varicose cell. This one has grade 1, 2, 3, 4, and it causes very low sperm count that never improves. It goes up, it comes down, goes up, it comes down. Sometimes surgeries are done to correct it. Our next point, we have hydrocele. Hydrocele is a fluid in the thin sac that surrounds the testicle. For newborn babies, it's more or less like a normal thing. It happens to newborn babies and correct itself. Sometimes it lingers and the doctor will just take care of it, but when it becomes an adult issue, it's a serious infertility issue. And then we have epididymal cyst. That's another fluid that is in these testicles, but this is a more complex one. This is a bigger challenge than the hydrocele. And then we have the epididymal orchid. That is an inflammation of the tube at the back of the testicles that stores and carries the sperm. That's another issue. When that is inflamed, the doctor will look into it. If you don't know, you might not even have a symptom at all, and you are there wondering why pregnancy is not happening. You are playing the blame game. You are talking about witches and wizards. You are talking about your wife being infertile. No, it is a challenge. Some people are suffering from hernia. Some people, their hernia is not that bad. They can't feel any symptoms. Some people have symptoms, but they don't take them serious. They feel it's because of stress from work and all that. It has to be taken care of for you to be able to conceive. And then we have testicular torsion. It's the injury from the testicles. Sometimes the testes are twisted, maybe from trying to do a strenuous job, or from maybe climbing a bike and all that. And then last but not the least, we have hormonal issues. Some men, their hormones are so unbalanced because of poor nutrition. They don't eat well, not because they can't afford it. Some people truly don't know what a healthy meal is. They feel anything that tastes good is a healthy meal, it's enjoyment. Some people know what a healthy meal is, have the money, but they don't have the time. Where to get the healthy meals is so far, and whenever they turn, it is the unhealthy one that can fill their stomach that is available because of the nature of their job or whatever they are doing at the moment. So these are the causes and the signs of male infertility. Sorry, I forgot infection. Some people have chronic infection, and infection is one of the leading causes of low sperm count. That infection called staphylococcus finishes sperm within 3 months. Even if you have 100 million sperm, let me say sure 1 billion sperm count, it can go to 0 sperm count within 3 months. So infections causes very, very low sperm count. I was talking to someone today that was making inquiries on my fertility program, and he didn't know that they can test his sperm for infection. He thought it's only urine. There's infection in your sperm. That is the one that eats the sperm up. That is the one that causes miscarriages, brings about bad embryos and all of that. So you need to go for fertility test as a man, so that they can take care of you. You'll be able to have children. Nobody is saying it is your fault. They just want to look into it. Okay, is there anything we can correct? What is the challenge? What if it is something that both of you can go on a treatment, or it is something that you can pray to God and trust Him more? If you are looking for a place like that, if you are going for tests and they've told you that you have issues with your sperm, you can contact me at Fertilemoms on Instagram. My name is Blessing Suleke, the Fertile Mom. I'm a fertility coach, I'm a health coach, I'm a fertility nutritionist. That is why I'm here. I'm talking about fertility. I know all this. Anything you discuss with me is strictly highly professional. Nobody is going to hear, nobody is going to see. The only thing I post on my page are testimonies without your name, without your identity. And you click the WhatsApp link in my bio on my Instagram page at Fertilemoms. It will take you to my WhatsApp page, or you can send me a DM on Instagram straight. So thank you, and I will see you again in my next video. Bye.